How are you, Dr. Lida? Good
I'm
to see
good, I'm
you.
good. شما چطوری؟ شد بالاخره شد.
I I know. I'm so glad. Thank you so much for
Mm.
joining me today. It's an honor to have you on my channel.
Thank you so much. I'm
So,
so
yeah,
excited to get to know more about it, and
I
it's
know.
beautiful. It is.
Thank you so much. Okay, so I want to
Yes.
say hi to everyone. So, today I'm so excited because we want to talk about this topic that a lot of my clients and a lot of people around me are very curious about. And there are so much information online that some may or may not be very accurate. So that's why today I asked the most beautiful Dr. Lida Fatemi to come and answer a few general questions about psychedelic healing, specifically psilocybin assisted therapy. So before we begin the questions, I just wanted to ask you to introduce yourself to our audience.
Yeah. Thank you so much for having me. I'm so excited. And I don't know, Jan, if you're okay with a little bit of Farsi in there. I don't know. I've been in the United States for a long time, and I challenge myself with Farsi. I still talk to my kids in Farsi, but I'm not a complicated Farsi speaker anymore. I need to go visit the country to really
Mhm.
absorb it all. It's been 25 years, but I'm a physician of internal medicine. I was in academic medicine for a decade at University of New Mexico, and I was a physician leader there. I had many awards there, and then I left because of the bureaucracy of institutions where you can't really also bring true healing to your patients in these big institutions the way you want to sit with patients. My grandfather in Iran was an internal medicine doctor as well for over 40 years, and he served and he loved his patients. And that sacred bond between physician and patient, that's where I learned it from. But when I came to America, I was 14 and then went into my higher education, then medical school and residency, and to get licensed in internal medicine. And I just saw it was the opposite of what I saw him do in our community, what he was bringing to our people in Tehran. He was also the director for Department of Health in Tehran for many years, and he really was a very high integrity individual. So I learned a lot from him. And so today, fast forward, what I do is I work with patients at the end of life. So I left my big title academic job that was very prestigious in that realm, left and entered the community in New Mexico to help those who are dying and their families. And it's such a beautiful practice with a lot of humanity in it, which I love. It's a very sacred transition time for us. And it, at the same time, really parallels what happens in a psychedelic journey. And so the other part of what I do is I started the Conscious Physicians Psychedelics Academy that's been in the works for about 6 years now. And now it's, over the ground, very official with the state of New Mexico being really, we are changing the laws here regarding psilocybin use for therapy and for the therapeutic benefits of it for the healing, for trauma healing. We live in a very traumatized state in the US due to the native population here, due to the South American population here. It goes really generation after generation. That there's just so much trauma that's been passed down. And that's been translating into a lot of crime, translates into addictions of many sorts, including substances, alcohol. Alcoholism is we are the top I know we get awarded, the all the opposites in New Mexico, it feels like sometimes, but, alcoholism is top, state, in the United States 2 times beyond any other state. So, it's a really big problem here, and, I've been advising the state of New Mexico on how to bring psilocybin forward in a safe way because it can be unsafe. Anything that we bring in, right? Any medication I prescribe a patient in the traditional medical model has good things and it has side effects as well. So that's where we are with what I do now and the integration of psilocybin mushrooms and end of life and patients who have treatment resistant depression, who have addictions, and who have PTSD, which a lot of us Iranians
Mhm.
carry that in particular, and treatment resistant depression. And end of life anxiety, honestly. And I'm sure there is addictions, we just do it in a different way, like
Mhm.
workaholism, you know.
Right.
So yeah, that's kind of the overview.
Awesome. Thank you so much. I think you kind of answered a little bit of some of the questions that I had in middle, but I'm just going to start from the beginning. I want to say, could you explain how psilocybin interacts interacts with your brain from your perspective?
Yeah, great question. So I usually go the scientific route because I'm a doctor. I've, had a scientific mind, and I think that's an important thing for us to know, though there's a lot we don't know and we're learning. So what we do know is that uh, first of all, psilocybin is a psychoactive compound in over 200 species of mushrooms that we know so far of in the world. When we ingest psilocybin containing mushroom, in the body, it digests and it becomes psilocin. So it's that psilocin, that compound psilocin that goes into the brain, and really all the serotonin receptors in the body, because we have a lot of it in our gut as well. It's not
Mhm.
just the brain. And so, again, we're in the beginning of our understanding of how all of this works. But psilocin interacts with 5-HT2A receptors, is what we know specifically. When we look at functional MRIs of the brain, when someone has ingested psilocybin at their peak and what is happening with the brain, we see what we call brain coherence and the default mode network, the part of the brain that is always thinking, what do I need to do next? That to do list part kind of shuts down and then the rest of the brain comes on board. So we have all of this interconnectedness of the brain that we don't see in another state, in a normal state, happen in an individual. The other thing that happens in the brain, because you asked about the brain specifically, is the neuroplasticity that we also see that is so significant. And what does that do? It gives us the opportunity to change all these patterns of thinking, of behavior that we're very stuck in, and it gives us an opportunity to create new ones. So it's very powerful medicine.
Mhm. That's amazing. Thank you for that explanation. So I know you kind of briefly hit on that. My next question is, what kinds of mental health conditions have you seen respond well to psilocybin therapy?
Yeah, great question. Thank you. I see depression for sure. Um, I've seen PTSD. Though with psilocybin, PTSD works really well. I mean, but also the other medicine that I like for PTSD is MDMA. I think MDMA has a really beautiful way of connecting us with our bodies, and in PTSD and deep, deep traumas, we dissociate from our body. And MDMA can help with that, bring us more heart-centered, more loving towards ourselves. Um, Psilocybin can also help OCD. I've seen that work really well in obsessive compulsive disorder. Again, treatment-resistant depression, we know of postpartum depression. It helps a lot. We know of pre-menopause and menopause, and it can really help with that time in a, in a woman's life. Um, what other mental I mean, to be honest with you, the list can go on and on and on. Addictions, we see this. There's a reason FDA came out and designated psilocybin as a breakthrough treatment
Mhm.
because it was really you name it and it can help it.
Mhm. Right.
Yeah, so and we are now looking at dementia, early
Mhm.
onset dementia and neurodegenerative diseases like Parkinson's disease, like ALS. Again, we're very early on in our understanding and in our research for it, but we're seeing promising results, that's for sure.
Mhm. You mentioned Parkinson's. My dad was battling with Parkinson's for the
Mm,
last like 3 years of his life, and I actually was reading a couple of papers on that, and it was very like it was touching my heart. Also, had to kind of grieve a little bit that we are a little bit behind where I was hoping that we were. So maybe I could have helped him that way, but there's so much going on as far as research is concerned, and I'm sure there's going to be more discoveries that we are still haven't found out yet. So
yeah.
super excited for that. As you know, I I studied engineering. Got my PhD, and after my dad's passing, I just kind of in the process of healing myself, I got really obsessed with the idea of helping other people through this. So now I guess this method kind of this modality gives me more hope for healing for other people. And this is just fantastic.
Oh, thank you so much, and thank you for sharing that. It's very painful, and there
Mhm.
is grief there, that we have to acknowledge and connect with and learn from. And I love that, you're not stuck in it, in that. It's that you're learning from it and you're using it as a part of your purpose.
Mhm. Right. Yeah, exactly. Yeah, I
Yeah.
mean, he gives me he taught me something that I will never forget. And it's kind of like trying to help others, especially people of Iran, is like really my number one goal right now. And as us going through all this trauma, I think mental health need is even more important now than versus before. So I think I'm grateful and honored to be a part of this crew of us helping Iranians too. It's amazing, truly. Yeah.
Yeah.
Hopefully, you and I can go to Iran, free Iran one day and have like a psilocybin retreat. And
I know, that's a dream come true. That's, my two places that I really care about is number one, Iran. That's where we're from. And it's been so challenging to, gosh, watch all of what is happening happen. And we feel all of the trauma, right? The everyday trauma of the people of Iran. You feel it in your body, you feel it in your soul, even if it's not directly yours, it is still yours.
Mhm.
And uh and I want to put this out there too for your listeners because you're so awesome. And I think it's so important, and I'm sure you've gathered some amazing humans around you. Um the the free Iran that we talk about, the more I sit with it in contemplation, the more I recognize that revolution, that freedom comes from within first.
Mhm.
We create our world outside of us from the world inside of us.
Mhm.
And the more free we are within us, and the more we have transmuted the traumas that have been passed down to us, the sooner the freedom will happen on the outside.
Mhm.
And that's the switch that I'm really hopeful that we can get into. And that can happen today. That can happen with every single listener here to work on our inner freedom from judgment, from all the fears that we carry with us, especially us Iranians. We are a beautiful people but we also have a lot of things that we need to work on to gain that freedom. We have to work for the freedom inside of us. We carry a lot of fear,
Mhm.
to really become aware of the fear and say, hey, this does not serve me anymore. Even with our
Mhm.
kids, with each other, where we behave from fear, we speak with fear, we speak from a place of censorship. That's happened for half a century, right?
Mhm.
And not to, you know, I've seen this happen in our community as well, where someone says something within a free space from their voice and inner space, and someone else comes in with judgment and tries to censor them. And not
Mhm.
to do that with each other, especially to
Mhm.
bring loving connections and non judgmental connections back into our community. I think that's when we really start seeing the real freedom in our
Mhm.
country.
I
Yeah,
agree with you. I truly agree. I think one of the audience had a question of, isn't ibogaine better for PTSD?
that's such a great question. Thank you for asking. Ibogaine is really hot right now in the news because there was an executive order that was signed for its research. Ibogaine is a really, really rough psychedelic. The main research that's been done for on ibogaine has been for opioid addiction.
Mhm.
And oftentimes, yes, opioid addiction, you trace it back. It goes into deep, complex PTSD. I've also seen really bad stuff happen with ibogaine. People who were not stable psychologically going into an ibogaine retreat, coming back completely dismantled in psychotic episodes, and taking their lives. So,
Wow.
yeah, it is not a medicine to be taken lightly at all. And sometimes people in an ibogaine journey, they have died because of the
Wow.
conduction abnormalities. If they have any heart issues and it was not caught before the retreat, that can happen. And my lens is education and harm reduction. So
Mhm.
before anyone touches ibogaine, I say, if that space interests you, how about you start with microdosing with psilocybin mushrooms?
Mhm.
Just start there. And I see some incredible transformations happening with that, especially with people who have PTSD. In the veteran community, we see this. And I highly recommend you all see Journeys Film. Go to journeysfilm.com. It's a documentary that is highly educational, specifically with psilocybin, and it goes down into PTSD with veterans, comes back to people in the community who've had, other traumas happening as children. I'm not going to spoil it. It's a really beautiful, visually, very artistic film. I had the privilege of being asked to be in it. It was filmed 2 years ago, And I'm in it briefly talking about end of life anxiety. So it also helps with anxiety very much, if you can
Mhm.
imagine, because, and it's really important for all of us to be very clear on a safe container for this work.
Mhm. Right.
And what is that? Is that you have to have preparation going into
Mhm.
any psychedelic journey and an extensive period of it. It may be a month to 3 months of deep work that you got to do on you. And that's the work we do in our academy, as you know.
Mhm.
Deep work of understanding where are my traumas at, getting to know the person who's going to be holding this space for you. Getting, do they feel good to you? And if they don't, if they're coming from a very egotistical place, narcissistic place, or I know everything place, that may not be the person.
Mhm.
There has to be a particular humility that comes with experience
Mhm.
and heart connection. And
Right.
having that person sit with you during ceremony for the 6 hours, if you're gonna engage, if you're interested in engaging in the full macro dose. And then afterwards, extensive period of integration. And what is integration? It's during the journey you learn things. Things become clear about yourself. And sorry, Manos, I'm going off grid right now.
No
But
worries. No, no.
I'm going with the flow of the conversation. I hope it's okay. Um,
Yeah, it's absolutely fine. Go ahead.
Thank you. And in the integration phase, it's extremely important for us to take what we learned in the psychedelic journey and then be like, okay, what do I do with this information now? This is a part of my story that's very different than
Mhm.
I identified with decades of my life. What do I do with this? And you need someone experienced to hold that gem for you and with you.
Mhm.
And so many things that come up to be able to translate that into long term behavior change, how we behave with ourselves, how we think about ourselves, how kind or how harsh we are with ourselves. And oftentimes you just realize, oh man, I've been holding on to these traumas, these patterns of being and behaving that's not even mine.
Mhm.
And that's a death, right? That's a death that we have to let go of, that identity that we thought was us. And you let that go and you have to reconstruct yourself differently. Like a snake that sheds its old skin now has the sensitive skin that's like, ooh, everything is like different in the world because you're perceiving it differently. So the
Mhm.
period of integration is very important, especially to do it in a safe community with a safe person that will sit and hold that space completely from a place of unconditional love and no judgment.
Mhm.
Because we do see harm happen if we don't do these
Mhm.
three things together.
Right. I mean, the patient, not the patient, but the client is in a very vulnerable place. And of course, the medicine can give give them all this, well, they are processing a lot of emotions. So then therefore there needs to be someone safe so they could like let it out or discuss anything that they really feel like they should in that moment, um, to piggyback on what you said, the research actually main thing that research really puts focus on is set and setting. Like you said, the set is the mindset, and setting is that space, that container that would really eventually can be detrimental if it's not appropriate. And I do see a lot of communities around that are creating a lot of these retreats, but I'm very against not having a mental health professional to be a part of these groups, because I can also see that it can harm you, and it's very powerful medicine. So it has to be taken very carefully. Now, that's like actually a good segue for my next question, which is what are specific safety considerations people should understand before considering psychedelic healing?
Safety consideration, at any time you're missing any of those pieces, if you're not doing preparation, if you don't know your guide, if you're not taking care of the set, and the set, as you brought up, yes, it's the mindset and it's the physical set, and it's also the emotional and spiritual set. So if you're not feeling prepared, it's like going on a trip. Like, let's say you're going to Iran from America. It takes a month or two to get yourself prepared, mindset prepared. Oh, what do I need to take with me? What do I put in my suitcase? Who do I buy what, صورتی باید بخری. Like, you have a whole list of things that you got to take care of. And so I analogize it to taking a trip, a big trip, an international trip. What are you going to take with you? You're going to take time, and then knowing who you're going to go with is important, because if that person is an unsafe person, man, is that it danger the most dangerous thing you can do is that go with
Mhm.
somebody who's unsafe. I'll give you an example. I have people who get in touch with me, and because they know, like, I'm more of a face in this realm now as a professional. And so I have calls from California to, Northeast and New York, and they're like, so and so took, some mushrooms, and I'm like, and they've lost their mind. I'm like, how do they do it? Well, it was at night in a dark alley. Somebody handed them some mushrooms, and then they took, like, they don't know how much they took, and then they're in a psychotic episode since last month. And I'm like, okay, get them to a psychiatrist. Like, they need medications it's like taking a baby out of a highway, you know? And you can re traumatize people in this way if we don't have all of these parts intentionally set out for us. So I see these three parts: preparation, ceremony with a in a good set and setting, with a good set that preparation does with you and for you, with a guide who is solid and knows what they're doing and has a ton of experience. If they're a mental health professional, even better. And integration afterwards. What we see in research, Mehnaz, is that there's a 10% chance. If you don't have these three components, there's a 10% chance that someone will have an adverse outcome. And that may
Mhm.
be re traumatization, that may be destabilization of their psyche, that may be they become suicidal even more, that may be a psychotic episode that you can't break, that may be a manic episode that goes
Mhm.
on for a long time. And so that's what we see as far as safety and harm reduction. We
Mhm.
have to meet those three components in a safe container with safe and connected people who know what they're doing. Yeah.
Mhm. Yeah. You mentioned the manic episodes. I mean, have you seen research talk about people with maybe bipolar disease or schizophrenia? Are those people more susceptible to, the um, adversity of this experience, or is there anything on like that? Have you seen, read?
Yes. Yes. Great question. In fact, if someone has had a bipolar diagnosis or manic episode or schizophrenia as a diagnosis or psychotic episode, they are not, they're excluded from research
Mhm.
because we know we can destabilize them with psychedelics.
Mhm.
At least in the more recent years, like Johns Hopkins, they started the research back up or it was ongoing, but it got more intensified around 2015, and to now we have thousands of research studies going on right now from all these Ivy League institutions, Yale, Hopkins, UC's, Emory, Baylor. They're all studying psilocybin specifically and other psychedelics, but UNM. Um, if you look at the research back in the 1960s, you will see that they were looking at schizophrenia, bipolar, and microdosing and using ketamine in these patients. Um, and some were being helped.
Mhm.
But you have to be very careful with how you're doing that with these individuals because they can destabilize, that's for sure. And that's why the more recent research has said, we don't want to do that to people. Let's have them not be part of the macro dose journey for
Mhm.
the research part of things. Um, there's anecdotal evidence, there's stories about people in the community who are working with that population and doing good work. But I do believe this population, what I see work best for them are practices that connect us with our bodies,
Mhm.
somatic experiences, creative expression like dance, like painting, art form, like working out hard, like
Mhm.
every day, work out for 2 hours. Like bipolar and schizophrenic patients do much better when they're more connected with their bodies. And this is and ketogenic diets as well. So
Mhm.
Dr. Chris Palmer out of Harvard, he is a psychiatrist who started experiencing or experimenting with a ketogenic diet for himself to get healthier. And then he was like, oh my gosh, I used to have some depression. I no longer have any. And then he started experimenting with his patients and he continues to do it in his bipolar and schizophrenics with incredible results. They no longer have hallucinations, the ones that stick with it.
Mhm.
In this population, it's also hard to have them consistent with a particular regimen. So,
Mhm.
but the ones that did stay consistent, they got better. And some of them were able to come off of some of their medications. So look him
Mhm.
up. He's pretty fascinating what he's doing. It's incredible. Um, and what we also see and postulate is that especially in patients who have schizophrenia, we see a higher amount of DMT receptors in their brain, which is a
Mhm.
psychedelic that is produced in our bodies endogenously. It's just part of our physiology that gets really excreted in at the end of life.
Mhm.
So when people have those lucid moments and they say lucid things and they say loving things, a lot of it comes, and then a couple of days later they pass away. It's most likely the secretion of DMT, the increase in DMT in the brain.
Wow.
Yeah, isn't that
Mhm.
incredible?
Very fascinating, yeah.
Fascinating. So psychedelics are part of us. It's not
Mhm.
something separate outside of us. They're part of us and they work with us. Yeah.
Yeah, thank you so much for that explanation. I just, yeah, wanted to make sure that we have kind of like be cautious while like if you're trying to pursue this kind of healing, you have to kind of be honest with yourself, and if you are if you have backgrounds of any kind of mania, any kind of schizophrenia, you have to be careful, because I personally know someone that unfortunately got, tried psychedelics, um, and I think that she was undiagnosed at the time, but she ended up being, in the hospital for days, and it was really bad for her. So But anyways, I'm gonna move on to my last but not least question before I introduce your book here. To our listeners, I wanted to ask you, how do you see the future of psilocybin assisted therapy evolving in the next 5 to 10 years?
Mm, great question. I just think there's going to be a lot more research that's going to come out. We're looking at psilocybin right now. There was a study that came out of Emory and Baylor University. They did collaboration on looking at longevity with psilocybin and how it's anti-aging, and it helps the DNA stay more stable, and it's anti-inflammatory to the brain and the body and on and on. And so I think the more we do the research with psilocybin, the more we're going to recognize, man, this is so good for us in so many different ways. My hope is that we continue keeping the earth medicine as earth medicine and not make it pharmaceutical. So grow your own mushrooms, like, like, come on, like, you can, and it's, one batch you can have for a year, it's not expensive to make it. You have to learn how to do it because it has to be, sterile environment, this and that. Now, that said, psilocybin is still illegal at the federal level, and in majority of states in the United States, it's still illegal. Internationally, majority of countries have it be illegal. So you have to be very careful. If you're
Mhm,
gonna use, you know, check out the law in your region and make sure you're not doing anything illegal. Or if you decide, what, I am too miserable. I have so much anxiety. I have so much depression, and I'm carrying this weight of trauma so deeply that I don't see a way out other than using, maybe microdosing, maybe, do it with somebody safe. Reach out. I have a website. You can always reach out to me. Like, I put myself out there because, yes, these medicines are very healing when done in the right way, and safety is number one. And so if you need someone to connect you with someone, I'm also part of this community with facilitators, really, globally. And so if
mhm,
you see that, do we have somebody somewhere, outside of the United States or in the United States in some other state, you let me know and I'm happy to connect you with the right sources, right people. And the product matters, who you get it from matters. But yeah, I see it go in a very beautiful direction. We are at the tip of the wave
mhm,
that's been building and building for the past, like, 10 years, and then it got faster for the past 2 years. Now we're, like, talking about it openly, which is incredible. So I can't imagine in 5 and 10 years, I think these medicines can bring so much peace,
mhm,
so much serenity that we all are asking for and needing in our everyday lives. In Iran, in war-torn countries like Iran, under,
mhm,
such, just incredibly chaotic ways of living, that deep trauma stays in your nervous system forever if you don't do
mhm,
anything about it. And then it gets passed down to your children, to your grandchildren, and on and on. And then populations that are traumatized make populations traumatized. And
mhm,
so, and then war continues because you don't have any peace in you. That's why that freedom, it comes
mhm,
from within. If I feel free within, if I feel peace inside of me, then I'm
mhm,
not creating war at all. I'm not even, right? I'm not giving that energy to it.
mhm,
And so I'm really hopeful that what we're doing with psychedelics now, and if we do it right, and if we continue on this beautiful path of conscious healing, I can we can look back 5 years, 10 years from now and look at this, live with you on YouTube and be like, "Wow, it really has. It's changed the world for the better."
Yeah. Thank you so much. I got goosebumps as, you said the last things. I mean, that's what I want really, to be part of a world, that is like, it's not this chaotic at least, But thank you so much, Dr. Lida. I'm going to link Dr. Lida's CPPA website under this video. Also wanted to introduce her book. It's called Conscious Physician's Method, by Dr. Lida Fatemi. I will also link the Amazon of this book down below if you were interested. Please go check it out. It has so much information, and it's very written in a way that a lot of us would understand, even though she's a physician. But this book, I would say, is for everyone. If you're interested, don't miss out. But thank you so much, Dr. Fatemi. Like, I wish I could give you a hug right now.
Big
I
hug. Me
appreciate
too.
Yeah. I appreciate having you on my channel, and hopefully, maybe we could talk about other topics around surrounding this psychedelic healing in the future with you. But I appreciate your time.
Thank you so much, John, and thank you for everybody who came on, and thank you for the work you're doing. It's true service. I hope you know this. And you are, your
Mhm.
intention of helping Iranians in Iran and also in the diaspora. We need it
Mhm.
so badly. What you're doing is God's work. I hope you know this. And I'm always here
I'm
for
gonna
you.
get emotional. I haven't cried on my channel yet. This is the first.
There's always a first time. Well, I'm glad it's with me because, we have that kind of relationship too. So,
Yeah. Absolutely. I think giving you a hug, when all those things were happening with Iran was like the most kind of relieving, the most meaningful, that I've experienced. So thank you for that
same,
too. Yeah.
same. Thank you. Thank you. We are so connected, so deeply
Mhm.
connected. And the work you're doing, the work I'm doing, it's uplifting all of us. And so,
Right.
thank you so much. And
Yeah, have a great day. See you
you
later.
too. You too. See you
Okay.
later. Bye.
Bye bye.